My name is Kate Taylor. I'm a nurse practitioner and clinical executive. I work here at University of North Texas Health Science Center in the Center for Older Adults, and I'm also a clinical executive for SaferCare Texas. So I've been here about 3 years working in the Center for Older Adults. I focus my work on clinical work, outpatient care, home visits, as well as advanced care planning visits. Well, patient safety is super important. It's the number 3rd cause of death in the United States, and that's a pretty scary number. It's behind cancer and heart disease. Also, patient safety work has been in place for 20 years. And JACO, one of the accrediting bodies for the hospitals, they came out with some patient safety goals about 20 years ago, and they are about the same now. So those goals haven't even changed because they're still important. So I think patient safety should stay at the forefront of every clinician or practitioner's or physician or nurse's job every day. Back in 1999, they had the AIR's Human Report stating how it's not bad people working in healthcare, but it's a bad system. So it's such a complex system. It's more complex now than it was 20 years ago. And so we need to remember those things. Well, older adults are a special breed. They're vulnerable. They have a lot of medical comorbidities that cause them pain, immobility, cognitive decline. So they are really a vulnerable population that needs special attention to avoid preventable harm and injuries. Well, I don't know if I sought my nursing career to treat older adults, but it sort of became it was a natural step. I worked as a hospitalist, and I saw the older adults there, and we just clicked. And so I like older adults because their stories are all different. So everyone comes from a different background, everyone has different goals, everyone has different situations and stories. So it's fun to me to come up with a way a plan with these patients to give them the best quality of life that they can have. Well, I think the first question of asking, about patient safety, why is it important, is really why we should all be advocates. And the bottom line is, if we don't make a conscious effort to change our practice, then errors continue. So I think about safety in the home because I do home visits, and you can think about things like poisonings, which 90% of those happen in the home, and people don't think about those things. So poisoning is one thing. Abuse, we think of neglect, but you can also think about healthcare, fraudulent behavior that happens, or abuse that happens a lot more than what we think. And of course, financial, and that can happen with family members or all the spam calls that people get, or all the fraudulent companies that are trying to get money from older adults. Other safety concerns for older adults would be driving. We often refer patients to Texas Health Resources. They have an occupational therapy program that does a simulation test with older adults to see if they're safe on the road. Other safety concerns for older adults: falls. That's the number one cause of injury for older adults. And so if you've had more than 2 falls in a year, you really should have a evaluation by a physical therapist. And one of my biggest concerns for older adults is polypharmacy. And so we know that 94% of the time, medications that older adults are taking, there's some kind of discrepancy what we think they're taking and what they think they should be taking. And although it sounds like a really easy job to look at the bottle and write the medications down on a piece of paper, and the patient's taking the medications on that piece of paper correctly, there's a lot of steps that take place between us taking the list, prescribing the list, and the patient taking the medication correctly. So polypharmacy or medication reconciliation is a real big concern for me.